average parent likely doesn't know what to do in these 5 scenarios, and they should, so let's talk about it. Number 1 is burns. If your child burns yourself, and this could be in anything, something from the stove, some hot water, etc., what should you do? Obviously, you should remove them from the heat source. You should then begin running cool water over the area that's burned. Resources suggest anywhere from 10 to 20 minutes. And while you're doing this, depending on where the burn is, how much of the body is affected, and how deep the burn is, you should immediately be seeking medical attention. Number 2 is allergic reactions. Everyone's mind for an allergic reaction goes right to Benadryl, but if you are having any kind of symptoms indicating an anaphylactic reaction, including difficulty breathing, facial swelling, lightheadedness, nausea, vomiting, etc., you need to head immediately to the emergency department because the treatment for an anaphylactic reaction is epinephrine. Number 3, if your child ingests something that is potentially poisonous and you don't know what to do about it, you need to call poison control. On that note, you should have that number easily accessible, even saved in your phone. Number 4 is head injuries. Your child falls and hits their head. What should you do? All that depends on a few things. If they fall from a height, generally depending on the age, if they fall from something more than 3 feet to 5 feet, you definitely need to seek emergency care. But outside of a height fall, let's say they just hit their head on something, when do you seek emergency care? Your child is having headaches, nausea, vomiting, any kind of loss of consciousness, if they are dizzy, if they are acting confused. These are all red flags to get evaluated. Number 5 is choking, and this is one that I cannot stress enough. I can't really explain to you how to save your kid if they're choking, but I will tell you, as I've seen many videos of babies choking and someone gently patting them like this. I need you to remember that true choking is a life or death situation. Please do not be afraid of how hard you are hitting that child, even if they are a younger child. Kind of the same scenario as CPR, where we would rather you have cracked ribs and be alive. We'd rather that child have a bruise on their back from really hitting them, stop them from choking, than you would for them to suffocate and die. Make sure you send this to all the parents you know out there so they can be ready in these emergency situations.